Good morning, everyone. Thank you so much for joining us today. My name is Kathy Minnis, and I am the Director of Product Strategy for Office Verticals. And with me is...
I'm Daniel Canning. I'm a Product Marketing Manager for Microsoft 365 ecosystem, and I focus specifically on regulated industries like healthcare. So excited to share some thoughts with you today.
Yeah, so as Dan mentioned, today we're going to talk about how Microsoft 365 can address some of these industry-specific scenarios. This session will have a focus on healthcare, so hopefully you are all where you intend to be. We will be talking healthcare today. As you all know, healthcare is becoming much more collaborative and team-based. We've moved from a system where there was one doctor caring for one patient to increased medical specialization, where up to 35 clinicians can be involved in a patient's care. And so that requires a change in the productivity tools and the technology that we're using to create this collaborative care environment. I'm personally extremely passionate about the need to solve some of these productivity and legacy technology issues. This is a picture of me heading into surgery 2 years ago, holding the teddy bear my nephews sent to keep me safe after I was diagnosed with a brain aneurysm. I was very fortunate that my brain aneurysm was caught before it ruptured, and thankfully, my surgery was a success. But during the course of my extremely complicated recovery, I saw firsthand the need for my doctors to be able to communicate and collaborate. I ended up having what my doctors called an electrical heart attack after one doctor prescribed a medicine that another doctor had advised against, simply because they didn't have the tools they needed to collaborate in real time. And now, of course, it is absolutely was my doctor's intention and all of healthcare providers' intentions to provide patients the best possible care. And what we want to do is help you do that and help you enable your clinicians to do that. So our objective is really to help get some of these numbers down. This is a staggering number, and in my opinion, a little bit heartbreaking. 1,700 plus lives lost due to just communication errors because that ability to connect and chat and collaborate on patient care, those connectors are missing. And so what we really need to do is, with this shift to team-based multidisciplinary care, that communication is becoming increasingly more important. We see, we need our PowerPoint to go. We see 6 times larger health teams, and this is what I was talking about when we're moving from that system of one doctor to one patient to up to 35 clinicians. When you have that large of a team, you have to make sure that everyone's on the same page and that they have the same amount of information at the same time. And in healthcare, it is the #1 industry for the highest cost for data breach. So yes, absolutely, first priority is patient lives. But just as important is patient information security and the security of your data. And every breach in healthcare is very expensive. We see about $130 billion lost to inefficiently delivered care. So Dan's going to talk a little bit now about the new culture of care that we are hoping to help deliver. And then I'll come back in a little bit and show you some demos of some of the systems that we've created that we're hopeful you'll join us in piloting.
Thank you, Kat. So one thing that we think about kind of creating a new culture for care, you think about, in your roles, in your jobs, your primary focus is, of course, on having a stable, secure platform to deliver infrastructure for your customers or your clients. But we want to think about how can Microsoft 365 as a platform go beyond kind of just the core scenarios and workloads that maybe you think about for information workers or that you think about for support staff. But in thinking about, we want to have you start thinking about ways that go beyond the mark of just having that baseline, which is very important, of a secure, compliant infrastructure. But think about scenarios that you can enable that will actually impact the quality of care that your providers give, and thinking about outcome-driven scenarios that can add value to platforms you're already investing in. Right? You're already investing today in Microsoft 365 as a platform, And with that, there's scenarios that you can drive that go beyond maybe just kind of thinking about mail, file share, et cetera, but actually thinking about outcomes. And so when we think about technology and how that could potentially solve and impact those numbers we just described, we see that kind of focusing in a couple of core areas. One is just streamlined communication and collaboration. Another one is making data easier to find and make it more discoverable. A lot of that also includes, of course, in places like healthcare, other regulated industries, there's always going to be a system of record. So of course in healthcare, that's the EMR, EHR, is a system of record. We want to be able to show ways that you can actually take that data from the EMR, EHRs, and send signals from that into the collaboration tools where people are getting their work done. And by doing that, you kind of up-level your productivity platforms to be more than just operational or support platforms, but they're ones that actually your clinicians can use to provide better care. And then, of course, all of this is done on the foundation of what we invest in from security and compliance, from enabling HIPAA compliance to our ISO standards, to having over 1,100 compliance controls built into Microsoft 365. It's a platform that you can build on for that. So that's how we think about Microsoft 365 in health, a complete productivity solution, intelligent data protection. You'll see a number of sessions this week where they go very deep on talking about data protection, how we can protect at the device level, how we can protect at the service level, and then all the compliance auditing that we can provide there as well. And then the other thing is that I want to think about this, like I said, is the goal of this session to think about how you can go from thinking about the core services you provide today, the support and value that they provide, but how they can actually go to that next level of thinking about scenarios that really impact quality of care and outcome. And so to think about some of the ways that we do this, we're actually out there in real life, testing these type of scenarios with customers today. This is not something we're just talking about now, but we've been working over the last year of actually working with clinical customers, like the NHS in the UK, where we're actually looking at doing bed management scenarios using Microsoft Teams, Power BI, and Visio. Working with Karolinska University in Sweden, where they're actually using Microsoft Teams together with SharePoint portals and custom apps to run tumor boards, and actually own line of business apps that they've written to have people get together and collaborate in a single meeting around care for pancreatic cancer patients. And then here in the States as well with Advocate Aurora, where we've run a pilot on actually using Microsoft Teams for scenarios around interdisciplinary teams. And so that's actually where you get together as teams and look at patient data and be able to collaborate in those meetings. So we're actually going to watch a quick video that shows a highlight of how that's being done across some of these customer stories. And we'll spend some time actually in a little bit actually demoing what some of our new investments are, many of them are platform-wide, but have specific applicability to the healthcare industry. So let's take a look at a quick video of some of these customer scenarios. I don't know if I need to push play.
I think you have to go to the next slide. I think if you click, it'll play.
Coordinating care in a workforce this massive is a big challenge. With the increasing number of patients, you lose physical communication. Human interaction was missing today.
The biggest challenge right now is everyone is communicating in their own kind of unique way that puts people in a position where not everyone is on the same page.
One of the most exciting things we have done is the adoption of Office 365 across the Trust, and in particularly Teams to improve the flow of information.
Doctors tend to make decisions around patients that they perhaps never have seen.
The whole idea was to bring the patient in our conference room, increasing communication.
It becomes so extremely important to work together.
The key aspect of care coordination is ensuring that everyone knows what is going on for the patient and what is the best treatment. Teams allows these clinicians to be communicating in a manner that allows for easy tracking and monitoring of different responses.
Because the platform is so easy and intuitive, we find a lot more collaboration taking place. This translates to giving clinicians the right information and the right tools, enabling those clinicians to spend more time with patients.
Office 365 was designed with HIPAA in mind to make sure that security is first and foremost. The Teams platform is directly connected with the electronic medical record system, so that allows for working with patient information in a secure fashion. What this does is takes down a lot of different barriers.
Health history, previous operations, lab results, which data examinations were done with the system. We would see all these parameters right in front of us on a screen. And it is a safe and secure system to use, making it easier for us as doctors to collaborate. My personal goal is to be a better doctor today compared to what I was yesterday. It is impossible to do it alone.
Microsoft gives us the tools, and I use them to empower my customers and clinicians.
So that's just a short video of showing some of these pilots that we've been running with real clinical teams. As I mentioned, NHS you saw there, Karolinska University and Advocate Aurora. Someone will actually talk a little bit in this session about their experience with it. So care coordination is a term that gets thrown around a lot in healthcare. And I realize that the care continuum is very long and has lots of facets to it. But there are specific workloads within the care continuum that in the platform that you already invest in today with Microsoft 365 can enable scenarios that are specific for healthcare. So for example, we'll spend a little bit of time today in demos showing you what we're doing around secure messaging. You saw that a little bit in the video of being able to actually take a picture within Teams, and we'll talk about a little bit how you can actually secure that to stay that on the desktop. Care coordination will actually, you saw in the video, actually showing EMR data directly within Teams, and that's what we can actually work to pull in, as I said, the data that comes from the system of record, and actually have that to be collaborated and interacted with, and then huddles. And what are some of the common scenarios that we see within our healthcare providers today? So with that, we're actually going to spend some time now demoing and showing you some of the new investments we're making in this space. And I'll let Kathy kind of run from that.
Okay, let's see. Yay. I'm glad the technology is cooperating with me today. That was my big fear, was switching. So as Dan mentioned, one of the areas that we have been partnering with some of our clinicians and IT collaborators is in this IDT setting, or an interdisciplinary team. And this is an example of how you would see an IDT within Microsoft Teams that's connected to an EMR. And so what I'm going to show you today is how you can pull in that patient data. We're using a sample. The HSPC here is a sandbox fire simulator, but see easily how this can also work with an HL7 EMR, which would require some middleware connectors, but it's a really wonderful way for teams to collaborate. This would be the channel, the dedicated channel, for those of you who aren't very familiar with Microsoft Teams. This is the dedicated channel where the group can chat and they can collaborate, they can share files. You can have all of the goodness of Teams in here, video meetings, all of this wonderfulness. And then when you're in the patient tab area, you can see here, I have an aggregated list of all of the patients that we'll be addressing in this week's meeting. And if there's a new patient, I very simply enter the patient ID. And you can see, we're spinning and thinking. Demo gods. All right. Put the wrong number. So Nola Dawson here, her FHIR ID is 72. And I'm pulling Nola in just a moment. There she is. So we can see she's in floor 2, room 14, and we can add her to this list. Oh, I already had her in the list. That's why she couldn't get there. So Nola is right down here, and I can click in and see a bit more information around her particular patient details. In here, we're pulling in all of that data from the EMR into our collaboration canvas. And it's just taking a moment. I think maybe a bunch of us are on the Wi-Fi today.
And one other note, just to kind of highlight on that, is we're not creating a system here where we're creating another system of record. The idea is through that Fire connection, what you saw was set up in that sandbox EMR, is pulling that data into Teams, and then it's there to be collaborated on again. So we're not creating a net new record in there.
Right.
And with being in Microsoft 365, you can set your own compliance timing for how long you want that data there, who can access it, et cetera. So we're not creating a new system of record. We're simply having signals or data from the system record that can be here for collaboration purposes.
So you can see here, we've got the profile information. We could have all medications, vitals, details, and add notes so that clinicians can see what each other has left notes around. And if you see here, I can go into NOLA's individual patient data manager, and I can click, and we will, let's say she has been admitted with an increased temperature. So you can see here, currently she's listed at 105. Ooh, that's a really high temperature. Let's get her temperature lower. We're going to say that NOLA is improving, and so we are going to change that to 98.6. You'll see it update here, and then if I come back to NOLA's card and refresh real quickly, hopefully this will connect a little more quickly this time. We'll go down to NOLA, and it will update instantly.
So you think about like the power of what you saw. You just saw data that was updated in EMR, and then literally that data was passed over in Fire protocol and transformed within that app that's now showing within Teams. So that's actually pulling in data that's in a standard format within healthcare and pulling that directly into the patient app.
And you can see here, it updated 98.6. So it's that connection, that real-time connection that can help address some of those challenges when you have the larger teams that are trying to coordinate care, and you've got all these different individuals trying to log into all these different systems. There's a statistic that shows that most clinicians log into 50 different systems. They badge in and out throughout the day. And the amount of time lost to that is pretty staggering. That's time they could be spending with patients or improving quality of care, that they're stuck in these administrative processes that really detract from what their main goal is, which is to provide that best care for their patients. So that's a quick example of the EHR. And then I'd like to talk to you a little bit about some of the enhanced messaging capabilities that we're bringing to Microsoft Teams that meet some of those stringent security requirements in regulated industries like healthcare. We will be shortly releasing priority notifications, which allows the user to send an urgent message. And so I'm going to show you what this will look like, and then I'll give you a live demo of another feature that is in Teams right now. So in healthcare, oftentimes the ability to connect quickly can literally mean the difference between life and death. And so we want to enable people to quickly and securely connect. Not on Skype for Business, excuse me. Not sure why that's firing. So if you see here, we can start a chat with a doctor and bring up an urgent notification. And you see, we've got this big red banner to really make sure that this isn't just a regular chat. We need an urgent consult in the ICU. So that message is sent off. It's marked in the outbox so that you are aware you have sent it as urgent. And then it arrives on the sender's phone, again, with that priority notification that marks it as urgent, so you know this is something you need to address. When you click the notification and you're taken to the chat, now if I get this message and I don't interact with it immediately, anywhere I go within Teams, that notification stays pinned to the top until I interact with it, so that I am aware that there is something that urgently needs my attention. So as I flip around, that's going to stay up there. Even when a new message comes in, it will stay marked urgent at the very top. And a priority notification will re-ping the user every 2 minutes for up to 20 minutes or until they respond. And after 20 minutes, then we follow up with a secondary touch point through email or SMS, depending on the policies that your administration has set up. And so it's a really great way to increase that quick connection in a secure and compliant way. If this was done in a consumer chat app, you run the risk of sensitive patient data being exposed or a little leaky because you don't have that security and compliance that we are able to offer based on the fact that we're built on top of Office 365. So the next thing that I'm going to show you here is I need to do one more switch. And I'd like to show you image annotation, which you saw a little bit of in that video. Now, this is something that I personally think is really cool. So often, doctors and nurses need to get consults from each other. And it's a very normal workflow for them to share pictures. You will often see in hospital situations, if someone unfortunately has a bed sore, nurses will take a picture and send it off to the wound care team so that they can quickly assess what sort of treatment needs to be provided, and then they can come provide the consult in person. So if I was sending a message to Dr. Miller, I simply select to take a photo, and we're gonna just take a picture of this little bruise on my hand here and pretend that I have presented with odd bruising and a consult is needed. So you can see I can very easily annotate this image and send a note. Need a consult. Oops, and learn how to type. And you have the option here to send it at various sizes based on the level of detail that you need in that image. So if it's something that you need really quick detail, you can go with the actual size. In the interest of space, I'm going to go with a small image. And you can see that sends off. Now, the cool thing here is in concert with Intune, your department can set policies that prevent that image from being stored on the personal device. If that had been done in a consumer chat app, the image would have been stored on that phone, but because it's in Teams, policies have been set that prevent it from being stored, enabling that HIPAA compliance.
That's great. That's very good. And that's kind of the power of the platform, is the ability to actually have scenarios like where you may have multiple kind of other systems that have to do some of these workloads, but with Office 365, you can do it all together. So now I'm actually going to invite up to the stage Dennis and Sherry from Advocate Aurora, who were some of our customers who worked in collaboration with us, actually doing care team coordination around an IDT that we specifically showed in the demo. And it was around, we'll talk a little bit about how they were specifically using Teams, and then we'll talk about how you can participate in some of these next steps. So, Sherry, I want to start with, maybe you can both introduce yourselves and your roles at Advocate Aurora, and then we can talk a little bit about the project.
Hi, my name is Sherry Ofterhide, and I am the System Administrator for Care Management Operations and Utilization Management for the system. So I really am responsible for supporting those care coordination efforts and proper utilization for the whole hospital system.
Very good.
And I'm Dennis Giles. I'm the Director of Unified Communication and Collaboration and Service Desk at Advocate Aurora Health. My role is really to enable the technology for health caregivers to find ways to utilize Microsoft 365 to enable clinicians to do their jobs more efficiently and effectively.
Very good. So, Sherry, first, can you tell us a little about what are some of the challenges that you see that exist today in providing care and coordinating care within Teams?
So I think that, everyone in healthcare is experiencing a lot of the same challenges. We have an aging population, we have greater comorbidities and health problems that patients are facing, much more complex care. As Kathy said, it's not the Marcus Welby days where healthcare wasn't very effective, but it was pretty safe because it was very simple. There are lots of different physicians that are treating patients for different conditions, and we are also on a crisis cost curve. So we're trying to figure out how do we manage care to give people good outcomes and still maintain efficiencies and cost effectiveness. So that's probably the biggest challenge, is how do we do the right thing at the right time in the right place for the right patient.
Thank you. And then Dennis, so what is your role in kind of coming up with the technology to then enable the scenarios to support those kind of workloads and coordination?
Yeah, so really my role actually started back in 2009, 2010, where Advocate didn't have, it was just Advocate at the time, didn't have a lot of great communication collaboration tools. So even in the email space and calendaring space, we didn't invest a lot of money in that area. So we worked with Microsoft and obviously implemented Microsoft 365. At the time, it was BPAWS, which is way long time ago. So we've been on the journey a long time with Microsoft. So part of the role, though, was really to look at things that even Kathy talked about earlier, the mistakes that are made in healthcare. A lot of it evolves around communication and collaboration and the ability to do that in a very complex medical environment. So part of what I do is to try to find opportunities within Advocate Aurora Health where I can bring technology to bear against issues that need to be solved around communication and collaboration. Now I do that through, one of the things we've done is we set up a committee called the Unified Communication Steering Committee that meets. It has representation from Public Affairs and Marketing, HR, Physician and Nursing Informatics, and Health Information and Technology as a facilitator and leader of that particular group. What we ask is that team meet once a month, so we get together for 30 minutes where we bring new technology from, for instance, Microsoft 365, other communication and collaboration platforms to that team to kind of vet and see what opportunities there are to solve problems within Advocate Aurora Health. And last year, I'll just mention this quickly. Last year we introduced Microsoft introduced Teams. We brought that back with the committee and introduced that, and that's how this whole thing started. And Sherry's on the team from Care Management, so we really we found a use case for it, and it's been very effective. The one other thing, I'm kind of running.
Please do, you're good.
One other thing I wanted to mention was that when you look at healthcare and the EHR, how it's built, a lot of the things we do are disjointed. We need to bring a group of patients together like Sherry does and her team, but that's not readily available within the EHR. So having a third-party software like Teams that can bring that collaboration together is really where the value is and the efficiencies.
Perfect. So Sherry, can you talk to us a little bit more about kind of what the IDT is, what's the goals, and kind of just how that process works today?
Sure. I think this journey that we're on in healthcare has been all about collaboration. How do we collaborate together? How do we break down silos? I operate primarily in the hospital space, but I can't do it alone. And so we really need to bring people from a lot of different areas together to manage the same patient. And so the IDT came from that. We have designees from the physician office practice. We have hospital designees. We have post-acute partners, so skilled nursing facilities, home health agencies, pharmacy. We have a lot of different people who can give insights and make recommendations into a patient's care. And so the IDT was really founded so that we could do that. One of the things that Advocate is known for is taking on a lot of risk for managing patients well, and so it is vital that we collaborate together to make sure that we can keep those patients healthy and give them the proper care so they have great outcomes.
And then, so how did Teams play a role in facilitating that weekly meeting for the IDT?
So it was a pretty basic meeting when it started. Someone ran a spreadsheet with the target patients, and it went out by email, and we had a conference call once a week at a designated time. And when Dennis had come to our Unified Communication Committee meeting and talked about the Teams program and how the Teams program worked, it seemed like the perfect fit to help enhance the ability of this team to communicate better. In working together in collaboration on the program and developing things, we identified the concept of the patient list, where we could have persistent information. So if we make a plan together on the call, which is every Wednesday morning, we can make a notation and everyone can see it. We may ask a home health agency to check and see if they can meet a patient's care need, and then they can make a notation in the system to say, yes, we can provide that service for the patient at home. So it really has enhanced our ability to manage those patients all across the week outside of just that one touch point that we were having in the past.
That's great. And so Dennis, of course, in healthcare, change management is a big effort and super important. How do you try to manage change in these type of pilot situations, or even as you roll things out more largely across your organization?
So we've been at this for a while. And we found that even with the implementation of Office 365, there was a lot of lag in terms of the adoption of the program, and folks just don't jump onto it. We were talking about it earlier today, just in terms of Teams and the effort to move from Skype for Business to Teams. It really takes a cheerleader, and as Dan just mentioned, it takes a change management, organizational plan to do that. So some of the things that we do is that we build communication plans around any implementation of any new software, any new technology, and the implementation plans are very detailed. They identify different channels of communication, time frames for when we'll push communication out to folks. So it's very robust. We work with the public affairs and marketing to actually implement that change plan and make it nice and sexy so people see it quickly. They can look at it and glance at it and actually hopefully adopt it. The other thing we do is we provide metrics around our adoption. So we're constantly looking at ways in which did that communication plan, was it effective? Did it provide what we wanted to in terms of adoption around a particular technology? All of this, again, goes back to that Unified Communication Steering Committee, where we develop those plans together and we determine what's the best alignment with the organization in terms of technology platforms, use cases, et cetera.
That's great. I mean, I love the idea of kind of that steering committee that can help drive that vision. One last thought, as you think about having these kind of this meta layer for collaboration, of course, there's always compliance concerns. Can you talk a little bit about how you think and address the compliance concerns and how you look at Microsoft 365 or even the BAA that you have with Microsoft in that role?
Yeah, well, one thing we do, we partner very tightly with our security team. So the Director of Security at Advocate Aurora Health is involved in all of our technology platform decisions, looking at technical assessments to make sure that we're meeting the strict standards that they put in place because, as we said earlier in the conversation, that is paramount for healthcare to be a very, very safe and secure environment. I will also say on the other side, though, because my background is clinical in my early life, there's also, you've got to balance between being innovative and really holding the technology to the highest degree of security. So it's a balancing act, and we work very closely with security to achieve that. And a lot of things that we've done is we partnered with Microsoft to identify areas where we felt that, not necessarily me, but our security team felt that we needed to really innovate in terms of
dive into
security
auditing,
and compliance center and those kind of things. So we take full advantage of the Office 365 environment there.
Sherry, one last thought from you on just how do you see the advantage of going to collaborative tools today versus maybe some of the manual processes that operated your IDTs or collaboration in the past?
So I think one of the biggest things is the concept of I have to connect and collaborate with people that I may not have known before and may not have an easy way to find. And so building that in Teams versus having to look in, even though it is online, having to look in the associate directory to try to find someone who was that person at Dr. Smith's office that I needed to talk to about these arrangements. What is the contact person at the home health agency? I mean, those paper lists that we would have stuck in our binder that we would refer to. This is a dedicated group of people, and so even if I don't have any idea, I can just send a message out into the team and say, hey, I'm looking for someone to help me with, this arrangement, and that person gets the notification and can respond back and say, it's me, Jane, let's set up a meeting. We can set the meeting up right within the team platform, and so it really has helped us to bridge that gap in the communication of manually having to try to track down. I mean, I think that gets in the way of our communication. Everyone is busy and we're worried about efficiency and trying to get things done. And, people will say, I just don't have the time to try to find that person today. So I know that the doctor will round tomorrow. I can touch base with them. It's not an emergent situation, but it really gives us the opportunity to move things ahead and be a lot more efficient. And I also think the persistent information that we have in Teams has also helped us dramatically because I can look back and see what did we talk about, what kind of notations did we make, and act on things where I might not have had easy access to that information in the past.
That's great. So thank you to both Dennis and Sherry for sharing their story. This is, like I said, a real pilot we've run. Actually, you can see the impact of using the platform Microsoft Teams in new ways in healthcare. We're actually publishing a case study about the Advocate Aurora pilot. It'll be online today, and so you can see more about that there. But I just want to give them a quick applause thank you for sharing that story. And it's been a great journey to work with them and actually kind of interact with a partner as well, Slalom Consulting, that worked with us on the project, and actually see how we could move forward these real scenarios. So this goes back to a little bit of how I started the conversation today, thinking about what are core scenarios, and then what are maybe some of those stretch scenarios you can think about from a collaboration perspective. So I want to share with you, these are some of the scenarios that where we see actual customers and partners working on today with Microsoft 365 in healthcare. So what I mean by core scenarios are ones that you can enable with the solution as it is out of the box. And these are ones that I want to highlight to you because they're ones that we're seeing in real time with other customers and partners. So modern meetings, we talked about that a little bit and Sherry hit on that, the power of having modern meetings, persistent chat being available, being able to go back and see conversations that they happened in the past. Clinician-to-clinician messaging. You saw the demos from Kathy where she showed the investment that we're making to have a secure, compliant chat platform within Microsoft 365. IT support is one Dennis and I have talked about, and it's also, I think, something if you're on the IT side in healthcare, you probably see as a potential to work with. You know, if you think about even the way we pull it as a platform, you know, SaaS tools like ServiceNow. We actually have some announcements this week where they're starting to do integrations into Teams. So you can think about, those are ones that are pretty common, IT support in Teams. Project management we would know about. You know about the investments we're doing actually of pulling in SharePoint even more and more. So the portal investments you do in SharePoint, with a click you can add those into Teams. But I want to talk about those two last ones for a second as well, which is LOB apps, right? So you have LOB apps today that you have that you're deploying, whether it's maybe a directory lookup, maybe it's an equipment request form. Those kind of tools you can bring directly into that single canvas, so you're reducing the chair swiveling of people having to find what they're working on and the tools they need to accomplish tasks. You can bring those into our single collaborative canvas. And then also huddles. This is one that I'm seeing a lot with different clients. If you think about the kind of huddle meetings that are happening in healthcare, and maybe safety huddles that are happening daily or weekly, talking about safety incidents and tracking those. Maybe it's process improvement huddles. You could be working with an organization where they're working hard on doing Six Sigma process improvement, or even shift change huddles. Those are all places today you see collaboration in healthcare, where maybe they're storing some Word document somewhere or some PowerPoint somewhere, where we have real examples of people lighting those up. And earlier this year, we actually shipped at HIMSS, I guess that would have been, early this calendar year, we shipped some code samples for how you could actually execute a health team huddle for process improvement. That project's online in GitHub. We open source that includes Planner, a bot, Power BI, and SharePoint to how to execute a process improvement huddle. And so those are things that you can start to go, but I want to point you a little bit towards these ones at the bottom, though. And that goes a little bit more to where we've been working with Advocate on going beyond just the things you can do out of the box, and think about scenarios that you can actually drive business outcome that your clients or your customers care about, not just kind of the core infrastructure. And so you can see those are some of the ideas there. So then what are the next steps that we want you to think about? Think about building a plan for having modern meetings and teams and getting those out there so you can get some of that success we've heard from Advocate Aurora today. Start using Teams today for secure messaging. You can start using that to have that workload maybe not be in disparate systems, be able to have that in your core platform, your communication platform. The other thing that I would mention is if you're a customer and you are interested in working with that app you showed that was actually pulling in FHIR data directly from EMR, you can work with your account team to actually participate in the preview we're having for our new investments we're doing around patient apps. So work with your account team on joining that. And then the last thing I would highlight is as any of those things like Dennis spoke about, change management in healthcare is expensive, right? What I mean is like the effort for change is pretty high. And enabled to pay for a change in healthcare, you have to have innovation that's good enough that the users will do that change management. And lots of times the best way to see that is running pilots. So look for an organization within your customer's organization or your client's organization where you can think about having a business sponsor, an IT sponsor, both of which we had in this Advocate Aurora case, and then run a pilot so you can build that internal case study and build that evangelism, and that's how you really start that flywheel for change. The other thing I would point out is, we don't do this alone. We're starting to work with an ecosystem of partners to help on this, whether it's on the pure SI side, folks like Slalom Consulting who worked with us on the Advocate Aurora project. Also other partners out there, Avanade and SADA, we're actively working with actually having these same types of scenarios that they can light up as SIs. But then also ISVs. You saw the way that we're pulling in data directly from the EMR. We have partners like Datica that we work with on actually being able to kind of act as that interop partner to pull in patient data to teams. But then also like No2 is another partner we're working with, where they're actually be demoing later today ways that you can actually enable a fax machine replacement within Teams. So instead of having a fax machine on one end of sending a referral, you can drop that messaging, that fax directly compliantly within Teams. So we do have a lot of momentum around this space, both in customer stories that we're telling and partners that we're enabling. So if you have interest in participating in the preview, let your accounting team know, and we can work through that. If you're a partner and you have solutions that you want to build in this space, from my job within the ecosystem team, it's to help tell those stories. So if you're a partner, you have a case study already in healthcare using Teams, using M365, let us know. If you're an ISV or an SI building new solutions to take forward, let us know, and we can help promote those. That's what we want to do, is tell those stories and really try to think a way that in these regulated industries, we can make the power of these platforms go beyond kind of just the back office or productivity support, and that's what we can do. So I thank you everyone for your time. I thank specifically Advocate Aurora for coming up here, and Kathy for her time in the demos. Please take time to evaluate our session, and let us know if you have any feedback. So thank you, everybody.
Thank you.